HSV1 is very common. I don't know if we've mentioned yet, but the prevalence in some areas gets well over 90% as you're an adult, but 70 to 80% in general. So what's the chance that your test was negative, but you're actually positive?
Yeah. So let's talk on HSV1 to start. So grandma kisses the baby.
Yep.
How quickly is that baby developing an HSV1 infection?
Yeah. So as far as like the stage in life, if you look at 5 to 9-year-olds, almost 60% of 5 to 9-year-olds will have an HSV1 infection. So obviously in their case, it's not actually sexually transmitted. It is kiss transmitted, if you will. After you get an HSV1 infection, it can take a couple weeks to get an antibody. Seropositive is what we call that. And often you shed, and even if you get it via a different way, whether you get it in the anal mucosa or the vaginal mucosa or the mucosa around the urethra in males, or orally, you are pretty likely to shed it via multiple locations and often for up to a year, regardless of your age. But yeah, if you look at the prevalence, which is what percent of a certain age group has it, worldwide, about 60% age 5 to 9, and about 70%, 67% 10 to 14, and right at about 70% from 15 to 19.
Yeah, and obviously the prevalence goes up with age because these infections, they sort of lie dormant. You think of chicken pox, and then someone gets shingles later from the same virus, same viral infection.
Yep.
And it makes sense that people would have it and it would progress in prevalence like that.
Yep.
And to your point, it works in multiple directions. So if you have, let's say you did acquire HSV1 orally via kissing, then you can very well shed that from the genital mucosa, or vice versa. If you acquire HSV2 via genital contact, then you can shed that orally as well. You do see numbers and like how many people are shedding go down, at 3 months, 6 months, 12 months. But it's somewhere around, I believe, the ballpark of 10% of people could still be shedding several months later after that primary infection.
Yep. And 1,000-foot view, the main thing to worry about is if your partner is pregnant or may become pregnant or may be pregnant. You do not want a female partner. You do not want a pregnant female to have a primary or a severe recurrent infection. Sometimes it's kind of difficult to actually tell if it's a primary or recurrent infection, even if they've had antibody titers, which we'll get into later. But herpes virus is the H in torch infection. And if you consider C a herpes virus, which it is the C in torch infections. Torch infections are just really bad infections in fetuses that lead to a lot of neonatal morbidity. So really sick babies with a lot of problems.
Yeah, and you can see some of the prevalence rates here. We'll put this chart up on the screen. You can see those vary different cultures. So you have your sort of worldwide population averages, and then the example here in the Eastern Mediterranean, you see about a 10% higher prevalence when people get to their 40s, let's say.
Yep.
And that's just because of the culture there. It's normal to kiss people when you're greeting.
Yep.
And you're going to have more transmission that way.
Yep. That's why a lot of doctors are anti-kissing during greeting, anti-handshake, anti-fist bump. They like the elbow bumps.
That's right.
Yep. The germaphobe doctors. So, which I suppose there is some merit to that. Interestingly, if you look at, and by the way, a caveat to all this, we'll talk about this more later, is are they doing immunoassays or are they doing Western blots for these tests?
Given that the Western blot costs about 10 times as much, most of these studies are done using immunoassays. And I don't know, perhaps we could jump ahead to what the positive predictive values and false positives look like there.
Yep. Lots of, high-level view again, lots of false negative HSV1 tests. So if you test negative for HSV1, there's actually a pretty good chance that you're not negative. If you test positive for HSV2, there's actually a pretty good chance that you're not positive.
So before we give people the numbers, what would you have guessed the false positive rate for HSV2 was prior to looking at the data that we saw earlier?
False positive rate. So of the positives, I'd guess, decent test. Maybe if it's an immunoassay, it's not perfect. Maybe 10% of tests are false positives.
Yeah, I would have thought the positive predictive value was something like 85%, maybe 15% are kind of
90, yeah.
indeterminate or giving you a false positive. But the false positive rate for HSV2 immunoassay is actually 50%.
Yep.
So if you have been told that you have HSV2 and HSV2 is the genital herpes, it could very well be either cross-detecting HSV1 or be throwing a false positive. It's a very high number. It's like a coin flip, basically.
Yeah. So takeaway here, if you've tested positive for HSV2, you can do confirmatory testing, although it's very expensive out of pocket and your insurance probably doesn't want to cover it. Unless it's like a very specific situation, like you're immunocompromised.
And the other scenario would be if you had a culture that was done on an active lesion, then that's going to tell you they do a PCR for that and they can tell. But for most people, if they're just trying to see, well, what is my status? Because they saw a headline, right, that says, hey, most people have herpes and don't know it because they haven't had an outbreak. You get a test with a 50% false positive rate. That's a lot of misdiagnoses.
And they've done studies after primary infection. So someone has a primary infection, they culture the lesion. Yes, it is indeed herpes. 2 months later, they had people swab themselves to see how many of those days were positive. And about 12% of the time, it was still positive. So they're still shedding, even without lesions, almost all the time without lesions. About 12% of the time at 2 months and about 7% of the time at 10 months.
So even almost a year later, you're still actively shedding. So the idea that you are unable to transmit if you are not having a breakout is false. I suppose it is less likely the longer it has been, but it's definitely not zero.
Correct. I guess we should talk about the false negative rate or the negative predictive value of HSV1 tests as well. So HSV1 is very common. I don't know if we've mentioned yet, but the prevalence in some areas gets well over 90% as you're an adult, but 70 to 80% in general. So what's the chance that your test was negative, but you're actually positive?
Yeah. So if we think about this, like HSV1 has a 10% false negative rate, which means what you're looking at in the table we just put up on the screen is potentially a little bit lower than what the true prevalence rate is, because some of those are false negatives, meaning someone actually was infected with HSV1. For whatever reason, the immunoassay just didn't pick up the antibody.
Yeah. So the true prevalence of HSV1 is probably more near 80% worldwide, maybe even a bit higher than that.
I think that's reasonable.
This data is also from almost 10 years ago, I believe. And we know that all prevalences of most STIs have increased significantly in the last few years.
Yeah. And if people are interested in what to know, well, what code or what test should I get if I want to know, absolute gold standard, the best, most sensitive and specific test, you can get it's called an immunoblot test for HSV through LabCorp. And the code is 138487. You can find this if you Google it. It's going to be substantially more expensive. So if you're trying to run this through insurance, I would be very hesitant about that, because you may get a bill for several $1,000.
I would not be surprised if insurance didn't cover it for $1,000. Now, our patient price on this is much lower. It's still over $100, which is much more expensive than just getting the antibody tests. But even with our wholesale prices, it is quite expensive.
Yeah, and here's just another data point to reference, like you spoke, frequency of all sorts of, herpes virus infections, because there's been a significant increase in oral sex, and at the same time, a significant decrease in any sort of protection being used during penile oral sex.
Yeah, I suppose we could also mention that obviously, even if there is condom use, even during oral sex, you can still get herpes viruses.